Hi there. Today we will talk about conventional radiography. My name is Ahmed Nazan and I'm a medical doctor with training in radiology. Images produced using ionizing radiation but without added contrast material are called conventional radiographs or plain films. It is really popular to order an X-ray or a plain film because it is cheap to produce, it is portable, there are mobile machines, and it is therefore the most widely obtained imaging study. As you can see, radiographs require a source to produce the X-rays. So this is the X-ray generator, and then it requires something to detect those X-rays. This is the film or cassette or photosensitive plate, and then you need a way to process those images either through chemicals or a digital reader in order to get an image like this. It can be used for many things, most commonly used for chest X-rays, for abdomen, and for imaging skeletal system like bones, for fractures and evaluate arthritis, or for evaluation of surgery and its outcome, for example, after implanting knee replacement or hip replacements, for example. Disadvantages of using conventional radiography is the limited range of densities that you can see on the images and using ionizing radiation. So as you can see, let's imagine this is the source of your X-rays, and then you put a hand here, and this is the film. Usually the film is covered with silver particles, and that when the X-rays hit the film, it becomes black. So once you turn on the source of X-rays, then you can see when they hit the film, they get black. When they hit the object, they get absorbed by the object, so the color remains intact of the film, and some even radiation gets reflected. And that's why if you're performing this examination as an examiner, you need to wear protective gear to protect you from the radiation or even leave the room. So in the images, you get 5 basic densities. Air appears the blackest on a radiograph, and then you have fat, which appears in a lighter shade of gray, and then soft tissues or fluid appears in a darker shade of gray. Calcium appears white, so bones will appear white, and then metal appears the whitest on a radiograph. If you have an implant that is made of metal, it will appear very white on a radiograph. So although it is very useful and used widely in radiology, conventional radiographs, but we have to remember that we are using ionizing radiation, and although we're using it in a very low doses, but still radiation can produce potentially cell mutations. So that is important to keep in mind, and that is why it's important for the radiologist or who's performing the examination to talk to the patient and make sure, for example, they're not pregnant, and make sure that the patient understand the risk and the benefit of this examination, even if this examination is done routinely.